Something I'd like to talk about, we've kind of talked about this in the back before, but I want to talk about it in the front. And those are what we call the zones of adherence.
Behind the mask, the more you know, the better you look. Behind the mask, the more you know, the better you look. Behind the mask.
If you look at the skin on the body, if you imagine that the skin is kind of not attached firmly to certain parts of your body, then we would just be this, skeleton, and we'd have all of our skin at the bottom of our ankles, kind of like a sock that had just kind of slipped down the ankle, down the leg, and just sort of pooled up at the bottom. That's kind of how we would look. So our skin has to be adherent. That's, in other words, stuck to our body at certain places. And that has consequences how we look, and it has consequences related to liposuction and tummy tuck and everything that we do. The first zone is really this kind of line here, where this skin is stuck. You have your breast overhanging. The only reason it can overhang is because this is fixed and stuck. We call this the inframammary crease, and occasionally I'll have to manipulate this crease to lower it or do something for breast surgery. And the skin is obviously adherent to the muscle underneath, but it's not as densely or strongly attached as it is until you get here. And so now you see there's another zone of adherence. And I'm just going to have you bend forward a little bit. So what you'll see is this is where she's going to bend. And so the zones of adherence are at these kind of points of flexure where we have to bend. If we keep moving down, we see another zone of adherence here around the belly button. And this one actually goes right through the belly button. And the fascinating thing is people have different locations for their zones of adherence depending on their overall structures where they bend. And now we see another zone of adherence in here. And this one is pretty important for us in terms of doing a tummy tuck. We're not doing a tummy tuck today, obviously. She doesn't have excess skin to do a tummy tuck. But if we did do a tummy tuck, we would make the incision here because that's the lowest point where she's bending. We might think about making it down here as well because that's another point of adherence. What is the significance of this? Why am I even talking or telling you about this? It's because after liposuction, you can see little bits of extra skin that may hang over top of these zones of adherence. So I'm going to remove all the fat. She's young. She's got good quality skin. Her skin's going to suck back and re-drape nicely. But she's still going to have a little bit of skin that's here, and maybe a tiny, tiny, tiny bit here that you may not see when she's standing up, but if she bends over, she may say like, hey, I got a little bit of skin here. It's normal to have this skin. We have to have this skin here because we need it for movement and we need it to keep our skin attached to our body. We have the same thing in the back, and this is what I've talked about before when we talk about back rolls. What is a back roll? Well, it's because she has a zone of adherence right here and a zone of adherence here. There's a slighter one here and there's a lesser one here. These, when they're up high, these zones of adherence where this skin is really stuck, there's not a lot of fat between the skin and here we are right on the rib. There's a little bit of fat there that I'm going to remove when I do her lipo and do the BBL. But you'll see that this zone of adherence here, because this skin is stuck, it's going to cause some of that skin to overhang here. That's why the back rolls, even though the skin is going to re-drape after the liposuction, and even though I'm going to remove the fat that's here, you'll always have a little bit of skin here. It's because this area is stuck. And so once this area is stuck, I'm right on her rib here. Once that area is stuck, you'll see a little bit of overhang in the skin. So it'll be less because there's going to be less volume, there'll be less fat here. and it'll be less because she's young and healthy and the skin is good quality, so it's going to snap back and contract after lipo, but you still see a little bit because we need this extra skin here. I'm going to just bend you. Put your arm all the way up to the ceiling and then bend to your left. Bend over. Keep going, keep going. Okay. Now you'll see that you don't really appreciate that extra skin because we need it to bend. So that's why we have that. Now just come back down. If you really want to keep on going down, you'll see that there's a zone of adherence here. This is the infragluteal crease. This is why the butt will actually have some projection and hangover. If we didn't have this crease here, then this would just continue on down. There'd be nothing to support her butt. If we look at the leg here, look at how smooth this is. So she has a zone of adherence related to her thigh interacting with her hip, because she has to have, just raise your right knee up in the air, she has to bend. So she has to have this point flex. But you'll notice, now look at the thigh. There are no zones of adherence in the thigh. So you'll never have patients complain about tissue hanging over here because there are no zones of adherence. Sometimes when you get older, you'll start to see some skin kind of hanging in this area, and people will complain about this because there are some zones of adherence down here. You don't see them as much as when you're young. So it's just kind of fascinating how these kind of zones of adherence match up where we bend. They produce some little extra skin that we can appreciate sometimes after lipo. And that's kind of how they're relevant and how they're important to what we're doing.